Hi, this is Dr. Reshma with you, and today I thought I will offer my thoughts on a talk by Dr. Abby Phillips, featured on Beer Biceps channel. In this talk, he extols the virtues of the conventional medicine while showing certain amount of skepticism towards accepting alternative medicine. And towards the end of his talk, he even rubbishes Ayurveda, comparing it with urine. So I thought this particular talk deserves a thoughtful response, and hence this reaction video. Chalo, let's watch it.
There were no actual treatments for diseases. And so it was a time when the light bulb was not invented, early 1800s. So at that time, if somebody had a headache, people used to drill a hole in the skull to reduce the headache. People used to bring the blood out, that is known as bloodletting, to reduce the headache. Or if people have some infection and all. I mean, they never knew that the germ theory, the infectious causes for disease also was not known at that time. So there was crude forms of treatment which were actually very painful and torturous for the patient.
Oh my God, anything old according to Dr. Phillips is kind of obsolete. So for this matter, he sets up the stage to appeal to the crowd that whole 1800s were completely crude and obsolete. Imagine the introduction of cell theory. Imagine the advancements in medical nursing at that particular era, the introduction to antiseptics, the discovery of medicines like aspirin and quinine, the malarial drug, and in fact, introduction to the early prototype stethoscope, even the word was coined then. All these are nothing but obsolete and crude, and it's just, it doesn't fall as the base for or foundational stone for this particular scientific medicine that we know today. In fact, for him, scientific medicine started with the knowledge of germ theory. It is very unfortunate to understand this, because with the myopia of modernism, he himself has fallen into a trap called appeal to novelty. Kind of wondering why he considered trephination or drilling a hole in the skull to be obsolete when we have modern equivalents called decompressive craniotomy, which serves almost the same purpose. In fact, those days they had sedative anesthesia and it was not painful at all. And it does not need big time anesthesia also, this procedure. Bloodletting is practiced today in the name of medicinal leaching, which is approved by the FDA. And of course, germ theory is not the be all and end all, if you see. Especially with the discovery of prions, the whole theory is being re-evaluated. I don't know how many of you know prions. Prions are not like viruses and bacteria. They don't have RNA or DNA, but are capable of transmitting diseases.
Doctors can see that the eyes are yellow, so it becomes a symptom and a sign, which doctors can also see. It's jaundice. Now, when I approach that jaundice patient, what will I do? I'll work him up for the causes of jaundice. So I'll first look at hepatitis viruses causing jaundice. I'll see if the patient is having significant amount of alcohol use. I'll see if this patient is on any specific drugs which can cause jaundice, because there are drugs that can harm the liver. So I'll look at all of these, and ultimately I'll figure out, yes, the jaundice is because of this disease. Imagine it is hepatitis B. The jaundice is because of that. So I give him a medicine for hepatitis B and the jaundice is gone. So he gets cured from the jaundice because he got cured from the hepatitis B. So the medicine is an antiviral, which is a drug that acts against hepatitis B, and then he's fine. Now imagine the same person going to a Ayurveda. Ayurveda has no concept of root cause.
If you see, the entire discussion here was revolving around the treatment of viral hepatitis alone. He did not describe anything about other diseases, because we know that viral hepatitis is effective and laudable. But coming to alcoholic hepatitis, autoimmune hepatitis, treatment of drug-induced liver injuries of the autoimmune type, if you see in these circumstances, the mainstay of treatment is just corticosteroids, because it is the inflammatory nature of the disease that is actually taken care of. Apart from, control of withdrawing the drug, apart from treating, asking the patient to have some lifestyle changes, the main treatment principle, if you see, it's basically the control of inflammation. Now, you can't substantiate saying that inflammation is the root cause, because if you tell inflammation is the root cause, then perhaps half of the diseases in the medical textbooks will be under that list. Sadly, we have to also understand that we don't have treatment for dengue, chikungunya virus, many viruses. In fact, paracetamol is the mainstay of treatment at the start of viral fevers. And you also have to understand there is a category called idiopathic diseases where we don't know the cause. I mean, there are specific therapies called empiric therapy employed where they don't know the cause because the treatment is based on experience. Here also we don't treat the root cause. In fact, approximately we have 200 viruses that affect humans. And if you see the list of antivirals, it probably is 20 on tops. Now, these are all not treating the root cause. Often it is symptomatic treatment. I mean, it can be substantiated by the whole therapy treatment that was given during the start of COVID pandemic. They neither had a cause nor had a treatment protocol, but we found that the hospitals were full. I mean, that's how the industry works. I'm not here to blame it. I mean, I always consider that this is how it works and it's excellent. Sometimes we have to understand that the industry is beautiful in its own way, but it should not call for a fight with Ayurvedic medicine, especially in terms of treating root cause, because Ayurveda gives a 360 panoramic view of treating root causes, especially metabolic diseases. I mean, as this doctor claims, if metabolic diseases were beautifully handled by medical therapy, modern medical therapy, then metabolic diseases like non-alcoholic steatohepatitis will not top the list for liver transplantation. This is something contradictory to what he's saying. Now, I don't mention all this to offend any of my friends in the conventional medicine. This is just done to keep such trash talk, such nonsensical remarks at bay. And if this is any excuse, this is it.
Even though we keep hearing root cause in alternative medicine practice, they have no concept. They have a concept of treating symptoms only, but not diseases. So jaundice in Ayurveda is just jaundice. They'll come with jaundice.
What else can it be? Now, I know where this problem kind of stems from, because the place where the doctor and I come from, basically Kerala, we have these words called Manyapittam and Kamala denoting jaundice. And therefore, this oversimplification in this common language has led the doctor to understand that Ayurveda also uses the same in a similar fashion. Unfortunately, it is not true. And this is an excellent example of etymological fallacy. I think he should have done his research a little bit more. I think he's not even opened a page in the Ayurvedic textbooks, let alone read the entire curriculum. All right. Now, coming to the subject matter. If there's anybody out there who's using jaundice as jaundice, it is people in the conventional medicine, because they use neonatal jaundice for jaundice in the newborn, even if they are under medical therapy. Now, coming to Ayurveda, there are three things that we have to remember. One is Haridra, which means yellowing of the body. Second is Haridra Netra, which means yellowing of the eye and the nails. And third one is Kamala, which is set of symptoms and signs indicating a disease. Now, the first two are symptoms, and third one is actually Kamala is a disease. This we have to get it right before we talk about anything in Ayurveda related to jaundice. All right. I somehow feel that this particular talk of this doctor reveals a kind of lack in familiarity of the subject.
And they have these ancient texts, which was written ages ago by these sages at the time, based on observation and faith and belief, but not tested.
This doctor affirms that Ayurveda is based on observation, belief, and faith. Now, if Ayurveda was founded on observation, it's only reasonable to call Charaka Samhita as observational reports or observational documents. Now, if you see the definition of scientific evidence, it is based on observation and documentation, and also experimentation. Again, with this definition, we can say that Charaka Samhita is scientific as well. Science often employs belief. It is not something new. In fact, I will state an example here. Newton's law was once contradicted by the beta decay experiment. They in fact checked whether wiring was right. It took them 26 years. They waited in belief till the discovery of neutrinos that resolved this issue. They proved that Newton's law was correct once again. Now, this is waiting in belief. A span of 26 years in the 20th century. Imagine. So there's nothing wrong when it comes to having faith, especially in a scientific field like medicine. It happens only when people develop personal experiences and positive health outcomes. It's very, very crucial. You can deceive a patient once or twice perhaps, but not over decades and centuries. It doesn't happen like that in medical field. If you have succeeded in treating patient once, probably by luck, twice, maybe fluke, but if you do it over and over again repeatedly, then you are the champion. Ayurveda is championed over 3,000 years, demonstrating its efficacy. So I totally agree if it is based on observation, belief and faith. I totally agree.
Not validated, not experimented on, without any other replication. That means, for some treatment to be useful, to be recommended or approved,
A large number of people.
number of people has to be tested, and it has to be from different groups. So I make a drug and I say that this drug is good for this. Doesn't make sense, because another group also has to say it. So otherwise it becomes a bias from my side. So it's my drug, so I say it's good, but that is known as validation and replicability. So this is all part of scientific medicine. In Ayurveda, it's not there. So it is not validated, not tested.
In the world of Ayurvedic literature, we find numerous textbooks like Charaka Samhita, Sushruta Samhita, Ashtanga Hridaya, Harita Samhita, and so on. Now, as per this, as this doctor affirms, if Ayurvedic medicine was founded on observation, it is only reasonable to classify Charaka Samhita and other texts as observational reports. Having said that, how do I know it is validated? Now, according to him, validation happens, or according to scientific evidence, validation happens at different points. The experiment is run again at different points of time in different centers. Correct. It has to be reproduced. Now, if you see, the observational reports are often corroborated by other authors at different points of time, at different places. So we have Harita Samhita, Sushruta Samhita at different points of time, with slight variations, with small differences of opinion. In fact, that itself proves that it's reproduced, because otherwise if it was just cut, copy, paste, these differences wouldn't have come. So it's only clear now that we have something which has existed for a long time, which has been tested, which has been observed, which has been documented, which has been reproduced, which has been validated again over and over the years. Now, it's like having a microwave with a manual. You can use it. We don't know how they ran the experiment. Only thing is, if we find ourselves so intelligent, we can do it. We can decipher it. But if you think that your elders, your predecessors, your preceptors were very intelligent, then it's time that we treasure it too. Either way, we have to take care of our Shastra.
You cannot falsify it, in the sense that you cannot change it, because it's already fixed in the textbook that in this case you have to give this only. Right. So the different causes for jaundice. So if somebody comes with hepatitis B, or somebody comes with hepatitis A jaundice, or somebody comes with alcohol hepatitis jaundice, Ayurveda treats them all same.
He dismisses Ayurveda in terms of falsifiability also, and he terms that Ayurveda is not scientific. Now, he gives an example here. He says that Ayurvedic medicine is all fixed, cannot be changed, and this supposes falsifiability. Karl Popper must be rolling in his grave, seriously, because falsifiability is not applied in this context. We don't apply falsifiability for set of theories, basically. I will not apply falsifiability against law of conservation of mass. It's not done like that, because by the very nature of the theories being put together. Falsifiability applies for small theories and to test hypotheses, scientific hypotheses at the low level. Now, we have problems with falsifiability in Ayurveda, but not in the premise that he states. In fact, he discusses that Ayurvedic medicines are a problem. No, Ayurvedic medicines are not a problem, because I can start experimentation with just buttercream. That will do. The problem comes when I try to extract individual variables per se for testing hypothesis, because Ayurveda does not assume in a similar fashion that the modern scientific research assumes, like to bring homogeneous crowd at a given point of time is very difficult in Ayurveda. Now, it's like if I have to put it in an analogy, then I have to say that working with a compass or a scale, when you really need a log table to do your arithmetic calculations, this is the current scenario. Because complex sciences like Ayurveda will deserve a separate scientific framework for doing its scientific research. And if there is anything that has to be scrutinized under the virtue of falsifiability, I would recommend to scrutinize the availability of medicines like paracetamol and atorvastatin that currently exist in the market, despite opposing evidence that prevents its usage. We'll start from there.
So which is why I say that Ayurveda is a pseudoscience. In the sense that...
Do you think all of it is a pseudoscience?
Of course, because the principles are all the same. It's based on Vata, Pitta, Kapha, and it's based on the elemental theory of disease formation. And if you ask an Ayurveda what a Vata is, what a Kapha is, how do you measure it? Please show it to me. They can't. They'll go philosophical.
No, I will not go philosophical at all. No, not at all. Let's discuss this as a multidisciplinary team. Let's bring in psychiatrist also, because when he shows the mind on the table, I will also put across Vata, Pitta and Kapha for him. Let's do that way, because it's quite easy, right? Then we can measure Vata, Pitta and Kapha like how a psychiatrist will measure mind. That will serve the purpose, right? We will have 50% specificity with the questionnaire and the checklist that we have for bipolar disorder, because you've constructed a medical model for psychiatry. Let's do it for Ayurveda also. But the problem is we will not have medicine for diseases. We will have it only for symptoms, but that's okay. Come on, let's take the deal. Let's destroy this entire complex science and just have medicines for symptoms, like how we did in psychiatry. We'll leave out all the narratives. We'll leave out all the clinical experiences. That's all anecdotal. Let's start only with medical model. Let's keep everything neurobiological or cellular, if that fascinates the science.
So I have integrative medicine. So integrative medicine is you have scientific medicine or real medicine, and then you put in some alternative medicine also into it to see you getting the best of both worlds, and a lot of people practice it. What I'm going to say might not be very digestible for people, but the way I see integrative medicine is, you have a glass of apple juice and you have a glass of urine. So you mix this urine with apple juice. What are you going to gain from it? Are you going to say that the urine gets better because it's in the apple juice now, or the apple juice is getting worse because the urine is there? That is integrative medicine. Something that works and something that does not work. You mix both. You are giving undue credit to the thing that does not work. So that is why, even though we have this traditional knowledge and wisdom and all that, we don't...
I was quite puzzled when Dr. Phillips uses the analogy of comparing modern medicine to apple juice and urine with Ayurveda. In fact, Ayurveda can be anything. It can be urine, it can be poop. I don't really care. Because as a hepatologist, he should know that certain times we have to treat patients with FMT, like certain diseases like primary sclerosing cholangitis and all. We need the patients to undergo procedure called FMT, where the poop of one person, healthy donor, is transferred to the patient. So it stands for fecal microbiota transplantation. Now here, apple juice doesn't work, even if he tries. So it's not about whether it's apple juice or it's about feces or urine. It is about what is to be employed to save the life of the patient. So a person, when he sees urea and urine, fecal microbiota in feces, and in apple juice, if he sees vitamin C, then he becomes a doctor, in fact. And a true doctor is one who knows where and when to give what. And that makes him really different, right? So I hope it is okay. Ayurveda doesn't mind being the poop or urine, as you say, as long as it can help dispel all the illnesses of the humankind. I rest my case.